Hey, what's up and welcome to this live demo where I'm going to cover how I want you to isolate an upper anterior tooth for endodontic treatment. We're going to be performing single tooth isolation and we have already anesthetized our patient's tooth number 8. Now it's time for airtight rubber dam isolation. Let's get into the operatory and give you the step-by-step visuals you're looking for. All right, Super GPs, most of these initial steps will eventually be done by your dental assistants, but you need to know how to train them. It's a good move to tell your assistant how you plan to isolate the tooth either before the patient arrives or while you're both waiting for anesthesia to settle, so there's minimal downtime. Tell your assistant if you're planning for single tooth isolation or a split dam because the setup is different. I like for the clamp to already be loaded in the rubber dam with the frame on before I even walk into the room to get started. The first step is to place the rubber dam itself on the frame. Then punch a single hole slightly offset to whatever quadrant you're working on. I'd recommend the punch be set at the second to largest setting for all your cases. For tooth number 8, we can basically be right in the middle in terms of left and right positioning, but offset the hole to the top so there won't be so much excess rubber dam material over the patient's nose. Even if there is, I would encourage you to trim it back with scissors around the nose. Then load your clamp. For the number 9 clamp, when isolating an upper anterior tooth, the slant of the clamp will be towards the facial. On rare instances, you will have a better clamp stability in the reverse orientation, which is fine, whatever gives you stable isolation. Use your rubber dam forceps to carry the entire apparatus to the tooth you're working on. Double, triple, quadruple check to make sure you're isolating the correct tooth here. Some dentists will actually mark the tooth with a wax pencil, which isn't a bad idea. Anyways, don't be shy about grabbing deep onto the cervical area of the tooth. The beauty of having anesthetized the palatal aspect as well is that you can grab as far down cervically, and even if you need to pinch the gingival tissues to isolate the tooth, it won't bother the patient. Whatever it takes to get stable isolation. Give it a little rock to ensure it's stable, then use your fingers or a paddle instrument to release the rubber dam material over the wings of the clamp. Inspect circumferentially around the tooth and make sure you have an airtight seal. It's rare for upper anteriors to have a lot of saliva seeping through, but it's imperative to make sure you have a dry area to work with. You don't want saliva, which is loaded with bacteria, getting into your operating field. Once we've confirmed that we've achieved stable and airtight rubber dam isolation, we're good to go. There you have it, friends. Remember, rubber dam usage is the standard of care in endodontics, and I hope this demo, along with the others, are going to help you feel more comfortable and confident in this critical yet relatively quick and easy aspect of endodontics. I'll see you in the next lesson.